Okay, personally, I would not, but let me tell you my thoughts on this. I'm Lo, former labor and postpartum nurse, CLC mom of 4, and here are my ideas. Membrane sweeps usually are offered starting around 39 weeks. They might offer to check your cervix around 37, 38, but usually the sweep around 39, they'll say, hey, do you want to do this as well? Possibly earlier at the 38-week appointment too. In general, my thought on a sweep is that when we are doing them this early, especially like before the due date, typically the body is probably not ready to go into labor. Now, can it be? Does it? Do some of you have babies before 38, 39 weeks? Of course you do. That's normal. But the majority of us are actually going to go into spontaneous labor around 40 and 3, 40 and 4, 40 and 5 days. So what this means is if we're sweeping, and let's say it does stir something up and get things going and the body does kick into labor, it's possible that we're kind of pushing the body into labor a little bit when it wasn't quite ready. And my big thought with that is about baby's position. And sometimes in those last couple of weeks, the baby is doing some work and the body's doing some work and we're getting baby into a really good position for labor. So my preference going into my labors is that I've given my body all the time it wants or needs, when that's possible, to get the baby in the best position for birth too. Because when baby's in the best position for birth, I personally think that birth goes better, it can go faster, it can be like easier because it could be shorter, you could push less, things like that. So I don't love the idea of sweeping early unless I really did know that baby was in a super great position. That would be one thing I would definitely want to be sure. Other big thing here is, what do you want to do for like pain control? What's your ideas about your labor? I personally always wanted spontaneous, like unmedicated labors. So I prefer that the body just do its thing when it wants to, and that we don't kind of push, or not force, but get the body to go into labor when it wasn't quite ready to. So I just want the process to clip along like naturally without any sort of intervention. And then my thought is that gives me the best chance to have babies unmedicated and to just deal with what my body kind of is going to throw at me. The last thing I would say is just know the risks, right? It's possible you could break the bag of waters. It doesn't happen a ton, but it can. And so then you're on that kind of clock because your water has broken. It's possible that, again, like we've talked about, we're pushing the body into labor, giving it a little nudge, and it wasn't quite ready because the baby's position wasn't great or something. And so then we've kind of jumped into labor and baby's still like OP, or they need to rotate or something like that. So those are big things that I would think about as well. But ultimately, this is super personal though, right? Like there's nothing wrong with getting a membrane sweep at 39 weeks, and tons of us are going to do it. I just want you to know the risks, pros, cons, etc. And so then you can decide, yep, this feels good for me, or nah, I guess I'll keep waiting and see what happens.